tooth and nail to keep the microphone and me away from each other. All right, so thank you all for coming. This is a fantastic event. I'd like to start out by saying in medical education, really there's three pillars. There's patient care, research, and education. And over the last decade or so, a fourth pillar has come up, which is advocacy. And that is something that many healthcare providers have really embraced and ran with. And I like to think of myself as one of those people. We fight day and night to improve the lives of our patients, both directly as well as indirectly. And my wife has migraine, so I don't call it migraine or your grain, I say it's our grain. Because, again, migraine is something that affects not just you, but everybody around you, your coworkers, your family, and the more we understand and express that, the better. For over a decade, I've been saying to my patients, listen, migraine is a disease. Don't think of it as a condition or something that's just in your head. It truly is a disease. It has a genetic basis. It's passed on through families, and then they talk to their family members and realize they have similar issues, and they in fact also have migraine. So it's great to hear people calling it migraine disease rather than just migraine, because that's in fact what it really is. It's also great to see that many of our partners who are here in the pharmaceutical industry also take on a similar idea and concept, that it's not just taking care of patients, research, and education, but it's also advocacy. So it's great to see them, and if we could have a round of applause for them as well, them stepping up to the plate and really delivering on the advocacy standpoint as well. And I also encourage all of you to advocate for yourselves. It's something that you can really take an active role in taking care of yourselves, whether it's calling the insurance company directly if you need a prior authorization. That's always helpful. I tell all my patients, some of you, thank you for coming, that are here. The squeaky wheel truly does get the grease, so yes, we'll write the letters, yes, we'll call, but if you could also do that, it's also going to help ensure that you get the care that you need. FMLA, which most headache specialists are very happy to do. We want to keep you active, we want to keep you working, and anything we can do, whether it's a letter to say to turn down the fluorescent lights, whether it's to give you a little bit longer break when you have a migraine, we're happy to do. I can't stress this enough, bringing in family members and friends to appointments. A lot of the time you will mention that you're having a particular symptom, but when it comes out of the doctor's mouth, all of a sudden it has more credence. Bringing in family members is tremendously important, just so they can understand what's going on. They can better support you. They can be there, your coach, your mentor, your helper, all those things. So that's really important. And really educating each other is really important as well. And a concept that I pitched just to Katie a few minutes ago, which I will challenge everyone here to do, whether you're a healthcare provider or whether you're a patient, is I was going to say migraine sky miles, but I think Delta would be very upset with us if we tried to do that. There might even be a lawsuit. But maybe migraine miles in the sky. I was traveling last weekend and actually wore my Miles for Migraine t-shirt in the airport on the flight to and from. And it's amazing how many eyes I could feel scanning my shirt, and how many people actually came up to me and asked, oh, I have migraines. And then I went into my unfortunate spiel talking about what I do and how I try to help the people with migraine. So I would challenge everybody here, if you fly anywhere, wear your Miles for Migraine t-shirt. You will have an amazing number of eyes in the terminal, on the plane, seeing your shirt. And again, the more awareness we can raise, the better. So thank you.